Okay, well, welcome everyone, and thank you all so much for tuning in for tonight's third session for our webinar series on pediatric epilepsy surgeries. My name is Seamus Morgan, and I am the Greater Philadelphia Resource Coordinator for the Epilepsy Foundation Eastern PA. And we here at the EFEPA and our friends at itsyourepilepsy.com are pleased to present you with great information, insights from epilepsy experts, and real-life experiences from families who have been through the surgery journey. You know, we understand that pediatric epilepsy surgery is a serious and difficult decision to make that frequently causes anxiety, fear, and we hope that these webinars have helped you and your family feel more comfortable and knowledgeable to make informed decisions. If you are also a provider, educator, or caregiver, you know, we hope you feel better prepared and confident in providing guidance and support to others. So before we begin, we want to remind you that your audio and video will be muted for the entire webinar. This webinar will be recorded for future viewing. You'll also have the opportunity to ask questions by typing them into the chat box throughout the webinar, and your questions will be presented to our speakers after their presentation. So it is my honor to welcome Dr. Carinna Scotti-Degnan, Trainor, and Alexandra Bullock and Jillyan Lynch. Thank you for being with us tonight. And at this time, I will hand it over to them. Control, and Carinna, I just gave you remote controls.
Great, thank you so much, Seamus. We are so excited to be here with you guys. What's the best way to advance the slide, Seamus? Oh, there we go. Perfect. Okay. So I wanted to talk with you all a little bit first to give you some context about what we're going to discuss tonight. We want to introduce you to the large psychosocial team that you may encounter at various points throughout your family's journey with epilepsy, particularly if you're contemplating the epilepsy surgery route. We're going to focus on 3 team members in particular, the pediatric psychologist, which is my role on the team, child life specialist, which is Caitlin's role on the team, and social work, which is Jillian and Alex's role on the team. And I'll be speaking about what an evaluation looks like with a pediatric psychologist, as well as how pediatric psychologists can help support families from deciding to pursue epilepsy surgery all the way through hospitalization. Caitlin will be speaking about the role of the child life specialist in preparation for surgery, as well as specific strategies you can use to talk to your child or teen about epilepsy surgery. And Jillian and Alex will be speaking about how social work can best support the entire family as you prepare for epilepsy surgery. We will leave some time for questions at the end, and we do ask that when you ask questions to respect your family and your child and teen's privacy by phrasing questions in a more general way. So next we'll talk about different psychosocial team members. Go back. There we go. Sorry about that. So first, a pediatric psychologist is a licensed professional who specializes in identifying behavioral, emotional, cognitive, and social concerns that are related to a particular medical problem. So in the case of your family, you would want to look for a pediatric psychologist that has experience with individuals who have epilepsy. And the goal of treatment with a pediatric psychologist is to modify factors that directly affect your child's health, status, and well-being. And it's important to remember that as pediatric psychologists, we do not prescribe medications for behavior. You may also encounter clinical psychologists. These are also licensed professionals at the doctoral level who specialize in treating behavioral, emotional, cognitive, and social concerns, but they don't have that particular expertise with medical condition or diagnosis. There are also licensed master's level providers, including licensed professional counselors, as well as licensed clinical social workers that also specialize in treating behavioral, emotional, cognitive, and social concerns. And neuropsychologists that you might encounter. Neuropsychologists are licensed professionals at the doctoral level who really specialize in the assessment of cognitive functioning. So as part of that type of evaluation, the neuropsychologist will test intelligence, academic achievement, memory, attention, language, and information processing to assess brain functioning, and then make targeted recommendations for interventions that might be helpful or even accommodations at school that could be helpful. There are also psychiatrists that you might interact with, and these are licensed medical doctors who can prescribe medication for behavioral and emotional factors. And of course, our certified child life specialists who are certified professionals that specialize in children's development in order to help maximize coping with diagnoses and treatments, and also provide developmentally appropriate preparation and education for hospital experiences. So you can see there are many different psychosocial team members that you may encounter during your journey that each provide a unique perspective and assistance for your family. So now I'll talk a little bit about a pediatric psychologist's role. So when you seek an evaluation with a pediatric psychologist, it should be really thorough and comprehensive. Typically, we'll allow about 90 minutes for this type of evaluation. And we start by reviewing epilepsy history, including what seizures look like, how others have responded to seizures, both within the family, but also peers and at school, limitations on functioning due to seizures, any worries related to seizures, how your child and teen is coping with their medication regimen, and what the family understands about the surgical plan, as well as questions or concerns that you and your teen or child may have. We then assess for different mood and behavioral concerns like oppositional or aggressive behaviors, anxiety, depression. We then will discuss who lives at home, what stressors and supports you all have as a family, how pregnancy, early milestones and development went for your child or teen. We also try to talk about, interests, hobbies, friendships, and strengths of the teen and child, and then go over academic history, including any difficulties or accommodations your teen or child may have, as well as maybe some needs for additional supports at school. And we will assess for safety as well with everyone that we meet. And the goal of this type of thorough evaluation is to really gather a sense of both the youth and family strengths and challenges to determine what behaviors and struggles may interfere with pursuing epilepsy surgery, but also how therapy could be useful to both the youth and family. So what are some of these problems that we might discover as we go through an evaluation? For children and teens with epilepsy, behavior problems, aggressive behavior, argumentativeness, defiance, lack of compliance are quite common, as is depression, which it's important to note that this can, look like low mood, sadness, but also irritability, particularly in teenagers. Anxiety, so that can, be worries about lots of different things, what if questions, difficulty with being flexible. And then cognitive and executive functioning. So those are things like memory, attention, organization. I also want to go over next kind of how we would address, some of these problems in therapy. So it's important to start by saying that most psychologists, whether that's clinical psychologists that you're seeing or pediatric psychologists, subscribe to different schools of thought in terms of therapy. And it's important to know what school of thought your provider subscribes to when deciding to pursue treatment. And evidence-based practices are treatments that are based directly on scientific evidence. Most evidence-based practices have been studied in several large-scale clinical trials involving thousands of patients, and careful comparison of that evidence-based practice versus other types of therapy. And dozens of multi-year studies have shown that these evidence-based practices can reduce symptoms not only in the short term, but for years after treatment has ended. So it's important to also ask not only what school of thought do you subscribe to, but is this an evidence-based practice? And the most commonly used evidence-based practice for children and teens is cognitive behavioral therapy. The efficacy of cognitive behavioral therapy, or CBT for short, has been demonstrated for a wide range of symptoms, including depression, anxiety, anger management. So many of the things that children and teens who have epilepsy might be struggling with as well. This type of therapy is pretty short-term meaning 6 to 20 sessions, and that could be weekly or kind of spread out over time, whatever you and your provider feel is most appropriate. And the goal is to focus on teaching skills that the youth can apply lifelong. And these skills really focus on how thoughts, feelings, and behaviors are all connected and affect one another. And I'll be giving some examples of this a little bit later as we talk about specific strategies that might be useful or that a pediatric psychologist might be able to teach your family in preparation for epilepsy surgery. Another type of evidence-based practice is behavioral therapy. And this therapy really focuses on how behaviors are influenced by the environment. So the focus is a little bit more geared towards parents than the child or adolescent. And it's to help parents utilize strategies to increase behaviors like compliance with requests, as well as to decrease problematic behaviors like tantrums or aggressive outbursts. And this type of therapy is particularly helpful for parents of younger children, like under the age of 7 or 8, or children or teens who can't participate in cognitive behavioral therapy for whatever reason. So when thinking about how I might apply as a pediatric psychologist these different therapies to help a family and teen or child prepare for epilepsy surgery, I like to think kind of in two phases, the preparation for surgery phase and then the actual hospitalization phase. In terms of preparation strategies, I find these three broad areas to be really helpful: psychoeducation, affective skills, and cognitive strategies. And you can see how this is going to pull from cognitive behavioral therapy. So psychoeducation is really important. We want to make sure that we're answering the questions that your child or teen has about epilepsy surgery in an honest, age-appropriate way. A lot of times, children and teens have questions about things that, maybe as parents we're more concerned about. What's the likelihood that this is going to reduce my child's seizures? What are, some of the things that might happen after surgery? What are some of the negative things I have to watch out for? And sometimes children and teens are really worried about how much school am I going to miss? What's my hair going to look like if they have to shave it? Things like that might get lost in the shuffle, but it's really important to address those concerns that they have. In terms of affective skills, validating feelings is huge. People have wide range of emotional reactions to the idea of brain surgery, and all of them are valid and need to be supported. Mood monitoring can also be a really effective strategy, and this is where we help teens and children recognize how our mood is connected to behaviors and thoughts. And so we might have teens and children write down how they're feeling as they do different activities during the day, or as different thoughts pop up, related to surgery. There's also relaxation training, and this is a variety of techniques taught to cope with stressors and physically calm the body down. So things like deep breathing, muscle relaxation, guided imagery, mindfulness, meditation, strategies like that. terms of cognitive strategies, constructive thinking refers to helping youth to examine their thoughts, really assess the accuracy and consequences, emotional consequences of these thoughts. So we teach youth to, once they've kind of got that mood monitoring down, look at, okay, what are some thoughts maybe that are making me feel more sad or irritable? And what's the actual content of the thought? And then we look at what's the evidence for that thought? And once we kind of look at the evidence for, we'll also look maybe at the evidence against and try to balance both of that, and then move into the positive self-talk phase where we use that kind of more rational thinking about ourselves, the world, and possibilities in the future to help increase this positive internal dialogue and help kind of decrease those unhelpful thoughts that might be popping up. And so, as you can imagine, it might take some time to really review and go over these strategies. And so I always encourage families to try to seek out help from a pediatric psychologist as early on in the process as possible. And then in terms of hospitalization strategies, so you're going to see some effective skills, distraction techniques, and other behavioral interventions. So again, those validation of feelings is so huge. These prolonged hospital stays without definitive go home dates are so hard for both you and your children and teens. And so just recognizing that this is really hard is so helpful. We also want children and teens before they get into the hospital to have an idea of what their coping skills are. What are things that make them feel better and help them to calm down? And what's the best way to cue your child or teen to use those skills? In terms of distraction techniques, we also want to think about what's going to be in my hospital bag. What are things from home that I can bring in to help give me comfort? Whether that's toys, blankets, pillows, pictures, whatever it is to give that comfort. We also want to think about what activities can I do in the hospital, which sounds kind of silly, but the reality is a lot of time you're kind of in your hospital room for hours and hours and not really too much to do other than TV. And so it's really important to think about what are some other things that we could either bring in, or can we partner with, our awesome child life team and have them kind of suggest some strategies or activities to use. And then other interventions that can be helpful. So structuring days, that daily routine can really help anchor days, particularly when days start to bleed into one another as you're in the hospital longer and longer. And this could be as simple as saying, we're going to wake up at a certain time, wash our face, brush our teeth, change our clothes. It could be scheduling to watch certain favorite shows or activities. And sometimes children may benefit from visual schedules too of what's happening for the day. Incentives, those special treats or surprises for compliance or having a positive attitude could be really helpful. And your positive attitude as parents is immensely important. Remaining calm and optimistic is so key because children and teens often look to their parents to determine how they should feel about, challenges that might pop up in the hospital. It's really important to also remember that you are not alone during your hospital stay. There is a team around you to help support you, not just your psychosocial team, not just, your pediatric psychologist, your social worker, your child life specialist, but your nursing and your medical team. So we are all here to help support you and your family. So please reach out for support when you need it. Thank you so much for your attention. And I'm going to turn this over to Caitlin, who's going to talk about child life's role in helping you all prepare for surgery.
Awesome. Thanks, Carinna. Hi, everyone. My name is Caitlin Adeletto, or Caitlin Trainor. I am a child life specialist at CHOP. I cover a variety of different surgical clinics, including neurology and neurosurgery. And today we're going to talk about sort of how child life specialists can be helpful in preparing our children for surgery. I'm trying to see if I have access to change slides yet.
Just unmuting myself. Dr. Carinna, does it ask you to stop to remote control? There we go. I got it figured out. Sorry.
That's all right.
Go. Okay, you should be able to.
Yeah, I got it. Okay, let me see here. So my thing is I can't see how to, oh, there we go. Did I do it? Okay. So some of you may have heard about child life, and Carinna did a wonderful job of explaining our role, but part of my job is to meet with children and sort of help provide them with a developmentally appropriate way of understanding their hospitalization or their surgery in order to decrease stress and anxiety in the hospital. I work with, like I said, lots of surgical specialties, and I get referrals from everyone. I get referrals from psychologists, social workers, the surgeons themselves, their NPs or PAs. So I always encourage parents to ask about child life in the hopes that they could sort of get plugged in somewhere. So we're going to talk about different tips for preparing for surgery. And a lot of this is very age dependent. So we'll talk a little bit about that, but we'll just sort of talk about general things about talking about surgery. So why should we talk about surgery? Why should we tell our kids that they're going to even have surgery? So the first thing for sort of starting top down is that it starts with them knowing about their diagnosis, which with epilepsy can be challenging at times because some kids don't even know that they're having seizures, especially our little guys. But what this does is that talking about a diagnosis or talking about a surgery helps foster and create and build upon that trust that you have with your child. And that sort of is paramount to anything when we're talking about, why it's important to talk about surgery. I think the one thing that I get the most from parents is I'm afraid that if they know what the surgery is, I'm afraid that if they know what's happening, they're going to Google things and find out the worst case scenario or see all these terrible things that I worry about as a parent. And, I think Googling these days is almost inevitable because kids have access to so much technology. If they hear things in passing, they might Google something. But that trust and that openness that you have with your child is going to encourage them to ask you questions instead of asking Google. Or they know, I asked my mom about this one time and she was honest with me, so I can ask her again this other question that I have, even though it's scary. And, if they do happen to Google something, that trust that you've built in that conversation that you started, that even if they do Google something, they will ask you if they see something scary, is that going to be me? What is going to happen? So continuing to have those open conversations is really, really important. And in the long term, talking about surgery is that, we are trying to create children that are going to be active members of their medical care as adults. And I say to parents, I know it sounds crazy to talk to a 5-year-old about this, thinking about when they're going to be 25, but everything that you do today is only going to help your child in the medical world and their experiences in the future as well. So how do you even go about talking about surgery? This is another big question that I get. So I tried to break this down on the left-hand side into sort of different things to think about. And then on the right is a little bit more specific. So it's always important to sort of think about what feelings are associated with the doctors. Does my child love coming to the doctors because they get all this attention and they get to see their favorite doctor, or are we nervous? Or am I as a parent scared or nervous about going to the doctors, but my child really enjoys coming to the doctors? And so being mindful of how your feelings are, but also how your child feels about coming to the doctor and talking about things. It's always good to start talking about surgery or bigger topics in a comfortable space. I get from a lot of teens and young kids that sometimes parents say it's natural to come up in the car because you're on your way to a visit or you're coming home from a visit, or there's something about being in the car that is just comfortable and familiar. But there's no need to have a sort of family meeting style sit down conversation that's very formal, unless that's how you have conversations in your home to begin with. And then honestly, I love to tell families to really start the conversation by assessing by asking questions. So, Joey, do you know why we go to see Dr. Kessler at CHOP? Or do you know what we were talking about with Dr. Kennedy? And really assessing what they know, because I think oftentimes children and patients surprise us in how much they overhear us talking about or what they understand. We think, oh, this conversation probably went right over their head, but really they're comprehending so much more than we give them credit for. So assessing what they understand by asking questions is a great way to start the conversation. And then also answering their questions. Once you've sort of talked things through, asking questions of, okay, so what do you want to know? Well, how can I be helpful? What can I answer for you? And providing honest answers. And as a parent, a lot of times that is sometimes saying, I don't know. And it's really okay to say that to your children. And I think also by showing them, by being honest and saying, I'm not really sure, we can ask Dr. Kessler, let's write that down. It shows them that, you know, you're not going to make up an answer that you don't know, right? You're going to provide them with honest information, which is really, really helpful. And then we're going to talk about this too, but really depending on the age is providing appropriate language to talk about these challenging things like surgery or like a diagnosis. So that sort of leads us into, well, how do I even talk about surgery, right? Like, how does this even come up? So I bolded some of the words here, and that's really to help enhance sort of how to make this child appropriate, but also just really important phrases that I think can be included in any explanation. So this is to talk about going to a neurologist or going to talk about surgery, but we're going to use this example. So, you know, we're going to talk with Dr. Kessler today, who's our brain doctor. And today we're going to talk to her about your epilepsy. And we've tried lots of different medications to help your epilepsy. And you've done a really good job taking all of them. And I think that really focusing, to pause here, on commending them for taking these medicines, even though they maybe have not worked, is really important to make sure the kid knows that it's not their fault that the medications didn't work. So sometimes medicines can help our epilepsy and make our seizures go away. But for some boys and girls like you, medicines do not help. And I think tying in the boys and girls like you makes them not feel as alienated, like this is something that is just happening to them. We don't know why this happened, but it's not your fault. Again, making sure they understand that this is not something that they did. When this happens, the doctor can help your epilepsy with something called surgery. So before I get into sort of how to talk about surgery, if your child has never had a surgery before, the word can sound very, very scary. But you as a parent have the privilege of sort of phrasing and introducing surgery in a really positive way that can impact your child's coping and, you know, progression throughout this process. So really normalizing the word is really important when talking about it. So surgery is something we do to help fix a part of your body. We're going to talk to another brain doctor to see if she thinks that surgery might help your seizures go away or happen less or whatever the outcome is. And again, really being concrete about what's going to happen and who we're going to see and why we're doing that. So this is just a great example. So another question I get often is, well, when do you even talk about surgery? When do you even bring that up with kids? And our rule of thumb in child life is to talk with your children in the number of days of your child's age. So if I'm preparing a 3-year-old, I want to prepare around 3 days before surgery. And every kid is different. You know, I've met some 5-year-olds who are super, super precocious, and the parents like, actually, you know, I think, you know, a full week of knowing about this would be really helpful for them to ask questions. That is totally fine. I've also met some 5-year-olds who the parents are like, you know, maturity wise, I think that they would do better with, you know, 3 or so days before. But the thought is that as your child grows older and their cognition, you know, continues to develop, it's good to give them the time and the space to ask the questions and to process the information. As another general rule of thumb, toddlers and preschoolers, it is a great way to start introducing the idea of surgery by reading books about surgery prior to even the preparation period. So for the 3-year-old, for example, I might start introducing Berenstain Bears Hospital Friends book into our nighttime routine. That way, when it's time to introduce the idea of surgery 3 days before, you know, I can say, hey, do you remember that Berenstain Bears book we read about, you know, one of the bears had surgery? Well, in a couple of days, we're going to go to CHOP because you're going to have surgery to help your body. So it's a great way to tie it in a very friendly and approachable way. And then with school age kids, so that like 6 to 12 and then teenagers, really, again, allowing that time for them to process and ask all those questions that they have is going to be really, really helpful in them coping with all this information that's being sort of given to them. So what do you talk about? outside of the specifics, these are just sort of a few things I feel like a lot of these age groups tend to ask about. So for preschoolers, it's about talking about what they're going to experience. So I can only speak for a CHOP, we give a medication prior to going back to the operating room, where most kids actually sort of don't remember going back to the operating room, and that's typical and normal. So I might not bog down the preparation with information about what the operating room is going to look like, because I know the preschooler probably won't remember it and therefore won't experience it. But what I am going to do is use really concrete language, because preschoolers, this is when imaginary play comes in. Their imagination sort of runs rampant. So it's good to use very concrete language when preparing them. Try not to use any analogies. Well, when you talk about anesthesia, it's not something that, you get put to sleep, because the dog also gets put to sleep. So keeping that in mind. For school agers and teenagers, I find that the topic of anesthesia is the thing that kids have the most questions about if they've never had surgery. And that's because it's not a typical medication that they get. And they've also probably seen some things on TV that create some misconceptions about anesthesia. So it's a great thing to talk about and address. And if you have questions about how anesthesia works at the hospital you're having surgery at, it's great to talk to not only the surgeon or the NP or PA who works with that surgeon, but also to talk with the anesthesia team as you're preparing for surgery. But what is that experience going to be like for my child? How can I prepare them? School agers tend to ask about how this is going to impact the things that they do and the things they like to do, mostly because at this age, they're starting to notice their similarities and differences to their peers, and they don't want to be different from peers. And for teenagers, they wonder, how is this going to affect my privacy or my appearance? So again, what Dr. Carinna was saying was a lot of our teenagers aren't worried about this, the bigger things about surgery sometimes. Sometimes all they want to know is, how can I hide the bald spot on the left side of my head, and really working through that image piece of things. The things to remember about like what to talk about for surgery is that to ask what questions they have. I think, myself included, sometimes we make assumptions about what kids are worried about or what they wonder about, and really asking them what they have questions about, not if they have questions, but what they want to know, is a really great way to sort of open the door into how they're feeling about surgery, what they're concerned about. And then the other really important thing is mentioning post-operative expectations. And I say that because we find that kids cope much better with their surgeries once they sort of have an expectation of how they're going to feel after surgery. So, letting them know, you're going to feel very sleepy when you first wake up from surgery, and your head might hurt, right? That's normal. That is a normal kind of pain we expect from this surgery. And so being realistic with them about how they're going to feel once they wake up. And if you have questions about how to talk about that or what they might experience, the surgeon is a great person to ask. Anybody on the medical team can reach out and sort of find out those answers for you. These are just a few resources that are helpful in talking about preparing for surgery. So you've got some children's books. We love Berenstein Bear's Hospital Friends book. It's a great book that just sort of reviews all the different people that help take care of you at the hospital. So it's very friendly. And then, Franklin Goes to the Hospital is another great one that we really love. And that talks about Franklin the turtle, my good old buddy, having surgery and his whole process throughout that. If you can, having realistic medical equipment also can sort of take the fear and the mystery out of certain things. So I know for myself, when I'm prepping kids, I typically have an anesthesia mask, let them know what that's going to look like. And then I have an IV that does not have a needle in it to help explain to kids that they're going to wake up with IVs. So it takes the mystery and the fear out of things when kids can see things, touch things, and manipulate them in a safe environment. And then always, access trusted resources, whether that's online or different books. CHOP, I can speak for us. We have great resources online of how to talk about surgery, preparing your child for surgery, but there are other great hospitals in this area and around the country that also have great resources. And it's really important to go with those trusted resources from different hospitals or organizations that support epilepsy. one of the questions we sometimes get is, how do we support our siblings through surgery? And that's something that Child Life also focuses on. So parents wonder, what should I share with, my son or daughter who's the sibling? I think it's reframing that information that you shared with the patient, but in a developmentally appropriate way for their age, right? So if the 13-year-old is the one having surgery and the 6-year-old is the sibling, really bringing that down to their level. And then how is this going to impact them, right? So sometimes it's really that mom is going to be in the hospital for 2 weeks or a week, and dad's going to be the one helping to take care of things, and how can you help, and those sorts of things. But then it's also trying to keep them connected, help keeping siblings connected. And right now, I feel like the big thing is FaceTime. I encourage families to do a lot of that. But for our younger patients, even some of our older patients as well, it's if a parent is going to and from the hospital and home, sending letters or art back and forth is a great way for them to stay connected. It's also a great way to pass some time when you're in the hospital, having your child create art to send back to a sibling. And then giving siblings a special task while the patient is in the hospital. How can they help out at home in a manageable way that's not, stressful or intimidating, that will give them something to do while they're waiting for their sibling to come home. And then before I pass it over, I know Carinna had briefly talked about, with hospital admissions, things that you can bring. And I definitely echo what she said, bring things that make your child comfortable. There is no limit or end. I tell parents, if you're staying for 3 nights and you feel like you're packing for 2 weeks, that is totally normal and fine. But also, ask your providers once you're admitted about things like music therapy and art therapy and pet therapy, and if they have those things available, and how you can get on lists to get those services, because that is another great way to cope with an admission and also sort of create some structure throughout your day. I know we blew through a lot of information, but I know that our social workers have lots and lots of great resources to share with you. So I am going to pass it over to Jill and Alex.
Okay, great. Thank you, Caitlin and Jillian. I'm going to give you access now. Oh, looks like they're just calling in real quick to before that present. So just 1 minute or 2. Thanks, everyone.
Hi, everyone. Can you hear me? Mute.
Hi.
Yes, we can hear you.
Okay. Great. You can hear me. You can hear us now. Perfect. I'm sorry about that delay. You're not IT.
We can hear you, Alex. Oh, looks like we can't hear you now.
Jillyan Lynch, alongside.
Sound is not the best. Is the sound a little bit better if we hold?
Yeah. Now we can hear you. Yep.
Okay, great.
Better.
I
Okay.
didn't realize we share an office, and apparently all of the office's speakers for Zoom are not working. So we apologize.
So
it's okay.
actually, if you could go back one slide. So, you know, as the final part of our presentation tonight, we wanted to introduce what a medical social worker is, kind of what role we play, and how we can support your family in planning for epilepsy surgery. If you could go forward one slide.
Jillian should have, sorry about
We
that.
should be able to do that, right?
Perfect.
Yes.
Okay, perfect. And this is lagging too for us, so I apologize. I am doing it. It's not working well for us this evening.
Okay. So one thing that we wanted to share with you are just ways that you can be supported. Social workers' role, I mean, we do a lot of different things. Basically, we help with life outside of the medical piece. So sometimes that means getting connected with the highest level of insurance. Sometimes that means, you know, thinking about everyone in your family's mental health. I know we've talked a lot about the patients themselves and their mental health and, you know, the siblings, but sometimes parents too. Thinking about everything that touches the patient and the experience that you're having navigating someone with complex epilepsy, and also thinking about surgery. So that's the kind of the big overview of how social work helps. Also, we help with school supports and planning for accommodations or things that your child might need returning to school from epilepsy surgery. And actually we can go, this is kind of more of the same. One thing that we really like to talk about, and if you are a family that lives in Pennsylvania and your child is under the age of 18 and has epilepsy, you would qualify for secondary Medicaid. If you don't already have primary Medicaid, financially based, if you have private insurance, like through your workplace, and you have, you know, some reoccurrent high copays, you know, going to the doctors, getting medication, all of that is costing you a decent amount. Likely you could qualify for secondary Medicaid, and that is a free level of insurance through the state of Pennsylvania that you have to apply for. And we really suggest doing it prior to surgery. Obviously, there's, you know, a lot of things involved in surgery, and you can have a higher level of insurance coverage. And it opens up a lot of doors. It opens up doors to mental health services, sometimes getting help in the home, like a skilled nurse to help with different types of things. It can open up a lot of doors and just give you the highest level of support and services. Unfortunately, our New Jersey families really don't qualify for this type of insurance regularly. It's more of a mix between financial situation and diagnosis. But for our Pennsylvania families, we really, really suggest getting connected and applying for this as soon as you can. It can really cover a lot of expenses and provide the most services. So I have the link at the bottom of this page. It's compass.state.pa.us. And I really suggest going there. You can apply online or on the phone, and you know, they talk to us and make sure they confirm diagnosis or wherever you're getting your epilepsy care, and then it's something that can help cover your child. For insurance for patients in other states, we can send something out. So every state has its own form of, sometimes there's waivers, like I'm thinking of the state of New York has waivers for those with chronic health needs that can cover the same amount of additional coverage. Delaware, is it secondary insurance or waiver?
They do have secondary insurance, so it really does, unfortunately, vary state to state, because it can absolutely increase or decrease one's access to these types of services. We are only intimately familiar with the tri-state area,
right,
and those families that we tend to serve, but we would always encourage you to reach out to your treating facility, your doctor, and ask if they have a social work team, or, for instance, CHOP has Family Health Coverage Program department who helps families apply for medical assistance. So definitely talk to your care providers and your team and see if your care team has access to someone that can help you apply, and talk through more of those programs in your home state, because these are great questions that we're seeing.
And I apologize for spending so much time on Pennsylvania. I didn't realize we had such a wide range of geographic areas. Florida, we're not familiar with, so I would suggest talking to your doctor and asking for your social worker. You know, at your next appointment, or you can send a my chart or whatever it is, ask for your social worker to talk about different levels of coverage that might be available to you. And, you know, this is something that has been talked a lot about tonight, and something that I'm sure is on the forefront of everyone's mind. Surgery is a big deal, right? So it touches every member of the family, and it touches every member of the family differently too, even from parent to parent to sibling to sibling. You know, no one processes in the exact same way, even in the exact same family. So for that, we really advocate that parents seek their own level of support. You know, it can be incredibly stressful, and it's nice to have a place just to decompress and get your own support as a parent who's navigating all these really just kind of challenging things. Also, for siblings of our chronically involved children, there's something, the national group actually called SIB shops, and they do sibling support groups, all school age, starting at first grade up until high school. And it's siblings who get together and discuss kind of what it's like to be the sibling that's not, you know, going to the medical appointments, to the hospital, things like that. And, you know, they have a great time. They have great conversations. CHOP here in Philadelphia, we have our own. I think we're meeting again in January, so you can reach out to your social worker if you're interested in that. But there are a lot of support groups specific to siblings too. And I saw a great question in the chat about, you know, do you suggest that everyone get counseling or cognitive behavioral therapy who's seeking surgery? I mean, we think everyone should have, everyone not even pursuing epilepsy surgery should have some form of counseling at some point. You know, it's a great outlet. It's great to get to know yourself emotionally, know how to manage stress, you know, just better function and have a support person. So a lot of patients really do, and a lot of our parents do too. So that's something that we really advocate and support, and we've seen a lot of success with families who are getting linked into their own support, you know, just do really well with navigating complex things such as epilepsy surgery. And also, you know, one thing that we think about in today's day, you know, we have a lot of families that are not your traditional family, right? It's not just mom, dad in the home. There can be many different households. What we really advocate for is that, you know, both parents, maybe one parent joins in the appointment by phone, you know, co-parenting, being really transparent, making it about the medical care, and keeping the conversation focused around medical care. So just to be as transparent as possible if you are in a co-parenting situation about epilepsy surgery and, you know, everything that entails.
So one of the things that Alex and I often do are help families access community counseling resources. So while we have our specialists here at CHOP, for our parents or siblings, we're often looking into community resources for those supports. And those are things that within our role, we are often helping families to navigate. So just some resources right off the bat that if you didn't have a social worker that was supporting you in this process, our main recommendations are to go to Psychology Today to be able to view profiles of local clinicians based on your insurance and your zip code, or contacting your insurance company. However, access to services is really challenging right now. So we have been kind of more hands-on than ever in helping families to navigate these resources. So depending on where you receive care, never feel shy to ask your care team if there are supports to help navigate these things. If you're having any challenges to getting connected, those are definitely things that we and our role as social workers can help link you with. There's just a little bit of guidance. I'm going to try and fly through a little bit more quickly now, just because we are getting towards the end and I want to leave room for questions. So I was going to go over some school supports and resources as well. A few differences in navigating accommodations for 504 plans and IEPs in a public school setting versus a private school or parochial school setting is that in the public school system, the public school must follow guidelines as far as requests and supports in navigating a 504 or an IEP plan. So even if the school is unable to accommodate a child's need, we're often reaching out to the school and connecting with advocacy resources to help find that correct placement. Unfortunately, private and parochial schools do not always need to follow, well, typically do not need to follow those guidelines. And so it's typically a conversation with the school as far as what that school is willing to provide. Some are willing to provide all the accommodations that a public school might, some are unable to. And so we're working with families often to help navigate how to balance that and how to potentially make a switch of school, whatever that may look like. So that's something that we do support around often. This is a little bit of a table on the differences between an IEP and a 504 plan. But to summarize, basically a 504 plan provides supports and accommodations to increase a child's access to the regular educational environment, whereas an IEP would serve to modify the regular curriculum to support areas of identified need. And those areas may be identified through a neuropsychological evaluation, as discussed previously, or through psychoeducational testing through the district. If a child has an IEP or a 504 prior to their epilepsy surgery, we may work with the family and the school to just check in prior to returning to school to make sure that the accommodations remain relevant and that any additional accommodations or supports that are needed would be implemented and put into place. Just some more information regarding kind of IEPs, 504s, and the differences between both. We had a list of examples as well, but again, these are things that often on the bottom, as it says, that we can assist with navigating and highlighting, as can our lovely friends at the Epilepsy Foundation. There are a lot of great advocacy resources that help to kind of navigate how to ensure that the right resources, supports, and accommodations are implemented accordingly. And then here are a few of the advocacy resources that we often are working with. Big shout out to the Epilepsy Foundation, because Seamus helps us with a lot of our own questions, helps our families. There are a lot of great resources that we can tap into depending on the state and the area to help bring in some secondary advocacy for our families and make sure that everyone feels supported and is hopefully getting the services that they need and deserve. Now I breeze through, hoping that we have some time for questions.
Yes, absolutely. Thank you so much, Jillian and Alex. That was really wonderful. So at this time, I'm going to stop sharing my screen. And if anyone does have any questions, please feel free to put them in the chat box. I think there might be some questions. I believe we had one for Dr. Carinna. Do you think that every epilepsy patient should undergo cognitive behavior therapy? I think we did kind of answer that a little bit, but to undergo cognitive behavior therapy in order to adhere to the proposed treatment.
Yeah, so I'll put a caveat on that. I'll say every patient, I think, should go for an evaluation with a mental health professional to see what may be the best match. And, you know, sometimes you'll be referred to me for coping with, you know, surgery, for instance, and y'all doing a beautiful job. I mean, just absolutely amazing, crushing it. And I'm just kind of call me as needed. So I think an evaluation is never a bad idea. And then you'll kind of make that decision about what's the best fit at what frequency in terms of therapy with your provider.
Wonderful, thank you. And then the next question we looks like had pop up in chat was, looks like this was for Keaton. Do you think that it should be easier to the child's parents be prepared to inform their loved ones about the surgery? that would be done on them and not the patient itself. So I think they're kind of asking, I guess, how to best prepare like the loved ones of the child for the surgery.
Yeah, I think, the way I interpret that question too is I think the information that I reviewed is sort of about preparing a family or preparing the patient absolutely can be used. I think gathering that information to prepare your loved ones, grandparents, other family members, other caregivers who may care for your child. But at the end of the day too, that information, any information about surgeries or diagnoses can be brought down to the level of a child. To help them not be as scared about what's happening, to reduce their fear and anxiety. And truthfully, Carinna and I work very closely with one another in that process of working with patients who are anxious about their surgery or stressed about their surgery, and making sure they have only the appropriate information that they need to cope.
Perfect. And I know the next question was about second insurance for patients in other states. And I know Jillian and Alex did touch upon that and provided some resources and advice. So that was really great. So thank you very much for that. But does anyone else have any other questions? If you do, please feel free to submit them in the chat box at this time. So it looks like no questions are coming in at this time, but that was really a lot of great information. Thanks. So I want to thank, I'm going to reshare my screen. So I'm going to go from.
You have one new question.
Oh, one new question? Oh. It looks like the question was, who is involved in the evaluation first?
So I can speak for an evaluation with a psychologist. So we will always, and I know COVID kind of has put a damper on it because we're physically limiting how many people can come to an appointment. But typically, we encourage as many people to come to an evaluation, siblings, caregivers, parents, the patient. I will, depending upon the age, kind of meet with everybody all together. And then, usually if a child or is 10 years old or above, give them the opportunity to also talk alone. But really, we want to be looking at this holistically. So I really encourage as many people to be involved, as you feel is necessary for your family.
Perfect. Thank you. Great question. Any other questions before I move on? Okay, well, I will go ahead and go back to share screen. Thank you for pointing that out, Clarissa. I appreciate it. So again, I want to thank Dr. Carinna, Alex, Caitlin, and Jillian for a really wonderful presentation and going through just so much knowledge and information and resources that's really needed, and we really appreciate it. And just a reminder that again, next 2 weeks from now, Monday, November 29th from 5:30 to 6:30 will be our next webinar series in our pediatric epilepsy surgery workshop. And we will actually be hearing from some families who have been through the surgery journey. So it's going to be another great session. So we encourage you all to tune in. And if you know anyone else that can benefit from it, to also please tune in. We'll be using the same Zoom link as before as well. So I know CHOP did put in a quick survey, so I'm going to hand it over to them.
Yep, so this is just a quick survey giving us some feedback about the presentation tonight. Totally optional. You can hold up your camera and the QR should link you if you feel so obliged.
Perfect. Thank you, Dr. Carinna. So again, before we end tonight, I quickly did want to share some about the closing remarks. Again, November 29th is our family experience. So you'll be able to get to talk to actual family members who went through this journey. It's going to be a really great one. So please, mark your calendars. I'll be tuning in. I'm sure I'm going to get to learn a lot from the family perspective. So it's going to be a really great workshop. So again, we at the Epilepsy Foundation do provide services in the 18 counties of Eastern Pennsylvania. And we are your local epilepsy affiliate of the Epilepsy Foundation of America. And we provide education, especially like seizure first aid trainings, talking about what epilepsy is, resources out there, support and advocacy services to the 110,000 individuals who are diagnosed with epilepsy, their communities, and also loved ones who are affected by it. We really pride ourselves in being a trusted guide through the epilepsy journey. So we're always here as a resource. We've been here for 49 years, almost 50, and we're going to continue to be here for at least, another 50 years. So we're not going anywhere. So just a little bit about our programs and services. We have seizure recognition first aid trainings. We do law enforcement, EMS, one of our big ones, and to anyone interested, we go into schools. We can do school trainings in person, through Zoom. We'll do one school staff member, we'll do 100 school staff members, doesn't matter. People want to be trained, reach out to us, we'll train them. We also do age appropriate ones for students that are really age appropriate. That can be done virtual through Zoom. We do age appropriate from early elementary all the way through higher education. We offer monthly support groups as well throughout the different areas. We have Philadelphia, Bucks, Delaware, different ones. We also have a parent support group as well too. Different advocacy efforts, tons of different community and awareness events as well. We have a Mardi Gras gala, a golf outing, walks to end epilepsy in Philadelphia, Lancaster and Berks, Lehigh Valley, Northeast PA. So much going on. We have educational conferences and webinars as well, educational webinars like we're doing tonight. We host educational conferences. You can go on our YouTube channel and our website, and you can find our past conferences, recordings as well, different information and referrals, doctor referral lists, mental health referral lists, insurance, different scholarship information, just a lot of different information. So if you have any questions on any resources you need, don't hesitate to reach us. We have youth, young adult, and adult services. We have services from early age all the way through up, to elderly as well too. And we have retreats and camps. We have an adult wellness weekend, not just for adults living with epilepsy, but any parents, who have a child with epilepsy. We just started it in September this past year. We go up into the Poconos. It's an adult wellness weekend for adults 30 and older to connect with other adults who are affected by epilepsy, and a lot of just hiking, therapeutic relaxation, a weekend getaway. We have a young adult retreat for young adults between ages 18 to 30. It's usually a weekend in May. That's at our Camp Green Lane. So that's going to be a lot of fun. And then we have a Camp Achieve, which is one of our most prized programs, which is a week-long summer sleepaway camp in August. We have a lot of campers, that come, about 50 to 70. It really ranges. This past year it was, we got a day in person and a couple virtual, but we're thinking 2022 is going to be back to the full week. We have counselors that a lot of them living with epilepsy that were campers themselves and come back as counselors. It's a great chance for campers to connect with other kids. We have amazing medical volunteer. We have volunteers from Jefferson, Penn, CHOP, just tons of different organizations. So if you're interested in any of that, please don't hesitate to reach out to us. So at this time, I'm going to hand it over to our friend Clarissa Martinez-Rubio at it'sYourEpilepsy.com.
Thank you so much. Good evening, everybody. Thank you again for joining us on this wonderful webinar series. I just want to give you a brief introduction to our new website. It's yourepilepsy.com. This website specializes on drug-resistant epilepsy, meaning that if you're looking for information when medications are not working for you and you want to find options, please come to our website. This is the only information available. So it's very easy to find and accessible and written in a very easy language to be understandable. Next slide, please. Also, we're working really hard to not only have the chapter, but also have more summarized one-pagers. So if it's a little bit overwhelming to learn everything at once, you can always find it in one-pagers where it's summarized and easy to read. And then when you're ready to get more information and learn more, you can go back to the website. Also, for every webinar that we're doing, we also have a key takeaway one-pager where the most important information that you are listening to in this hour will be summarized in one page and sent out to you after the webinar. And again, if there's any topic that you think that you're like, oh, I wish I would have known that, or why didn't I learn this 5 years ago throughout my journey? If you send those questions or you send us those topics to info@itsyourepilepsy.com, we do everything in our power or anything possible to really develop that and make it a new resource. So please come check out our website, itsyourepilepsy.com. Thank you and have a great night.
Perfect. Thank you so much, Clarissa. So thank you everyone so much for spending your evening with us. We hope you had a great night and enjoyed the presentation. It was really wonderful. We look forward to everyone attending our last and final session on Monday, November 29th from 5:30 to 6:30. And again, one big last thank you to Clarissa from It's Your Epilepsy and our wonderful speakers tonight, Dr. Carinna, Caitlin, Jillian, and Alex. Thank you all so much. We really appreciate your time and effort. So again, thank you everyone. Please take care and we will see you all soon.
Thank you, everyone.
Thanks
Bye.
for having us.
Thank you.
Good night, everyone.